You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
Good evening, our beloved viewers, and welcome to the Doc Talk Show, a show where I bring you professional, qualified, and very compassionate doctors to talk about topics that are very important to our lives and those of our beloved ones. My name is Dr. Sechanzi Henry, and yes, like we told you, every Thursday, starting 9 p.m. on this very channel, we shall be right there to give you health information that will help you live better and a very, very quality life. Today, we're going to discuss about a condition that's one of the most misunderstood conditions in our society. You realize that many people think that whenever somebody has abdominal pain, they call it ulcers. I've actually seen many patients who come to me and they're telling you, yeah, I have ulcers, and be like, how did you know? And actually on deeper questioning, you realize that any abdominal pain that they get, they call it ulcers, but most of the times it's not true. And joining me to discuss a little bit deeper about what ulcers is this team of doctors, Dr. Resabula and Dr. Inaitwe. I'm going to request them to introduce themselves, and then after that, we shall get right into the discussion. But before that, I want to remind you that this show is brought to you by the Ministry of Health, the ministry that is responsible for keeping us healthy, to ensure that we live happily, because it's health bodies that will make that money, as well as the Cameline Men's Collection. These people have the best suits in town. If you have any event, you have a date, you have a party, you're going for any event and you need to look good as a man, go to Cameline Men's Collection, grab yourself a nice suit and look smart and go for that gig. Also, if you have any feedback, or maybe you have any questions, or you want to tell us about anything about this show, please, our numbers are right there on the screen. Send us a WhatsApp and we shall be able to get your feedback. Now, doctors, back to you. I'll request you to introduce yourself, and starting on my far left. Yes.
Our beloved viewers, my name is Dr. Alex Resabula. I want to thank you for giving in your precious time to be part of this show, to listen in and learn, and as well allow me to thank the Ministry of Health.
Thank you very much, Dr. Alex, and it's a pleasure having you here. Yes, Dr. Inaitwe.
Thank you very much, dear host. Good evening to you, viewers. My name is Dr. Esther Inaitwe. I am a very passionate medical doctor. I am glad to be here to teach you one of the most common conditions that is faced by very many people in the country, and a condition that can actually be fatal. So I pray and hope that we learn something from this show. Thank you.
Awesome. It's a pleasure having you doctors with us. Like we told you, that here we bring you professional doctors, qualified and compassionate about the topics that we discuss about. Now, Dr. Esther, like you've highlighted about this condition, peptic ulcer disease. Can you please enlighten our viewers what this condition means? If they hear peptic ulcer disease, what should come to their mind? What's up with this condition?
Peptic ulcer disease, just from the word, the disease name itself is a condition whereby one has a sore on the lining of the stomach or the duodenum. Our stomach has that inner lining called it's lined by the mucus. So this mucus is very protective in that it prevents the acid from attacking directly the stomach wall to cause the ulcers. Most of the times we have a balance of the ulcer that is of the hydrochloric acid that is being produced and the mucus that we have in the body. Once there is an imbalance, that is when the condition peptic ulcer disease results.
Wow, thank you very much for that introduction. Doctor, you've highlighted a very important point that normally in our stomachs, we have this protective layer, the mucus layer that prevents acid, which acid is important for digestion, breaking down this food. So this layer, it prevents this acid from
directly attacking.
Okay, and so when you have those wounds, that's what you call the ulcers.
Yes.
I don't know if Dr. Resabula has something to add.
Maybe something to add on, as she said, the stomach. When we eat food, that first bag that stores this food as it is being broken down, that's where food goes first. Okay. And then after that, she talked about the duodenum. It's either the stomach or the duodenum. So we have an ulcer like a wound. We have that mucosal kind of lining being interfered, or its integrity being affected. And then after that, we have this acid that is actually supposed to carry out a spectrum of functions. getting directly in contact with the wound. It's like how you pour acid on a wound. Of course, you expect pain. Or how you pour acid directly on maybe the skin which is not covered. You expect what? You expect pain. So that condition that comes when we have that breakdown of the integrity of the mucosal lining, either in the stomach or that first part of our intestines, which we call the duodenum. That's what we call peptic ulcer disease.
Thank you very much, Dr. Lesabula. As you've heard, it is when you have that sore. It's not that every abdominal pain you have is ulcers. There are so many other things which could cause abdominal pain. Sometimes people could even be having cancers of the stomach, okay? But simply because they're having abdominal pain, they think it's ulcers and they'll treat ulcers for generations on generations until a time when the cancer is advanced, and that's the time they come to us for care. So let's all know that ulcers is, yes, when you have that wound or sore in that stomach and you'll get these symptoms, but there are so many other things which could cause epigastric pain. Dr. Esther, I want to know about how common this condition is on a global scale and maybe also here in our local setting. How common is this peptic ulcer disease?
Peptic ulcer disease, the prevalence of this condition globally is around 5% to 10%. So, according to WHO,
meaning that every 100 people that you see, around 5 to 10
yes,
have peptic ulcer disease.
Yes.
That's
so. According to WHO, the data that was published in 2020, they said that 687 deaths were of the total deaths in the country were due to peptic ulcer disease. So this clearly shows that peptic ulcer disease is a very common condition and it can be very fatal. So that is why we need to take keen. Yes.
Well, so 5 out of 10 over 100 people is actually a big number. Somebody might think that.
So of every 100 people that you find on a daily basis in your class, in meeting, around 5 have peptic ulcer disease.
That's quite a big figure. And like Dr. said, it's also one of the contributors of mortality. So we need to address it and make sure that we get timely treatment to prevent this condition from getting worse. So I want us to talk about the causes of this peptic ulcer disease. Dr. Resabula.
Yes, sir.
So what are some of the commonest causes, especially in our setting here?
The commonest causes, one, I'll begin with one of the things that has actually affected many Ugandans. You know, Africans, we have a problem. We tend to do things that we are not professional about. So one of the things that we most of the times do is self-medicate. So I find that when someone has maybe a headache, someone has pain somewhere, something that they always run to is to procure some medications from the pharmacy, take them without a prescription of a qualified medical doctor. So there are medications that we take that interfere with the integrity of that mucosal lining that we talked about. The production of the mucus, it's produced in a process. It does not just come out of nowhere. So there is a process that comes in to produce that mucus to ensure that it's there all the time. However, there are drugs that interfere with that process of production of mucus.
Dr. Esther was telling us about the cells, the goblet cells, the ones which produce the mucus.
Which produce the mucus. So if we have the production of the mucus being interfered with, that means that we shall not have enough mucus to protect these areas that are mostly affected. And as I talked about painkillers, because these are the most self-prescribed medications in Uganda and I think worldwide. Painkillers, yes. Most of them usually cause ulcers. Of course, there are those that don't cause. And then there are those that do what? That cause. And then you also find that when someone has symptoms that are related to ulcers, there are those medications that they take and exacerbate. So
or make it worse.
Make it worse. Yes. They make the condition get worse. And like I told you, those are what we call the non-steroidal anti-inflammatory drugs. These are drugs that we usually take to treat pain. When we get pain and we need to get relieved of the pain, we just go buy them and then we take them. Not knowing that either we are putting ourselves at a risk or we are exacerbating a condition or we are making worse a condition that's already existing, and that's peptic ulcer disease, or what usually people term as ulcers.
Okay.
Yeah.
Wow, Dr. Risabla, you bring out a very important point of these chronic or these medicines that people usually are used to kill pain, and especially there are people who have actually very, very bad pain, especially people with orthopedic conditions, people with conditions that require actually a medication that relieve the pains, and sometimes they are on very strong NSAIDs that can actually erode that mucous membrane. That
But
you
usually,
mentioned.
when we have a patient with such a condition, us as health workers, we know that if someone takes these medications for a very long period of time, they're at risk of getting these ulcers. So we get a way of preventing
it
the
from
ulcers from
happening.
happening.
Yes.
So that's why I'm saying that we shouldn't self-medicate. Even if it's just buying that painkiller, it could be something that's going to send you into the grave very early.
Actually, Dr. Resabla, one of the other things that I've also noticed is that there are times when we tell our patients that as you take this medication, better you take it after a meal. This is not a routine for all medications, by the way. And there are some medications which are better taken on an empty stomach. So your doctor will always be very clear on this, and they'll tell you that maybe for this one, you take after a meal. For this one, you take on an empty stomach. And for some of these conditions that require these painkillers for a long time, sometimes we give some medicine to protect your stomach. Okay, so our doctors out here, they know very well this medication, and sometimes they'll give you medication to prevent maybe some of this process from going on of causing the ulcers. We want to take a short break, and when we return, we want to talk about other causes of ulcers apart from the NSAIDs. I'm sure there are quite a number of other causes. So, Dr. Esther, I think we shall take a break, and when we return, you'll take us on with the other possible causes of peptic ulcer disease. Our beloved viewers, thank you very much for being part of this show up to now. We shall take this short break and be right back to continue with peptic ulcer disease and its causes.
This message is from the Ministry of Health with support from partners.
Since 2015, Quiz Mali Production has been at the forefront of media innovation. Our passion for storytelling and creativity has driven us to deliver over 100 successful projects, making a lasting impact on the industry. With 4 highly acclaimed TV shows, we've become a household name, bringing quality content to your screens. At Quiz Mali Production, we specialize in content creation, digital media marketing, media buying and documentaries. We plan corporate events, provide top-notch photography and videography services, and offer seamless translations and live streams for your every need. Join the hundreds of satisfied clients who trust us to bring their visions to life. Quiz Mali Production, your partner in media excellence. Visit us at Quiz Mali and let's create something amazing together.
You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short break. We're still continuing the Doc Talk Show, where we discuss real solutions to real health problems. Yes, in studio, I have these 2 compassionate doctors, and we're discussing peptic ulcer disease, and we have seen the causes. Doctors have told us how NSAIDs or some of these drugs used to kill pain could actually make our ulcers bad, and they have told us about some of the things that can be done to prevent this. Now, I want to continue with this conversation, but before that, I still remind you that this program is brought to you by the Ministry of Health and Cameline Men's Collection. So, Dr. Esther, apart from NSAIDs, what are some of the other things that could cause ulcers?
So actually, the commonest cause that the commonest cause of peptic ulcer disease is a bacteria called Helicobacter pylori. Short in the short form being H. pylori. So this bacteria can enter our bodies through eating contaminated food that is not properly cooked. So this particular bacteria has a way of, this acid is supposed to kill the bacteria that enters with the food. But for it has a mechanism in which it can bypass this. So there's something it produces that breaks down. It's an enzyme called urease that breaks down urea to ammonia, making that condition, that the stomach condition that is more acidic, less acidic, and making it able to survive more and multiply. So when it multiplies, this bacteria can cause inflammation. It produces very serious toxins that can cause inflammation or swellings in the stomach, that will weaken now the integrity of the stomach wall. The other thing is that it can also reduce the mucus production, like we talked earlier. This mucus lining is good for, it protects that stomach lining from being directly attacked by the acid. So once that mucus production is reduced, that means that the acid can directly attack the stomach wall, making it very weak and then causing the ulcers.
Okay. Well, thank you very much, Dr. Esther, for that. Realize that this bacteria, as Doctor has talked about it very well, it's not that everybody who has this bacteria has ulcers. There's a very big population out there who have the bacteria, but actually they don't have ulcers. Though those who have, many of the people who have ulcers, actually they have been found to have this bacteria. So as Dr. put it, that one of the tests that can be done is actually the urea breath test. I think we shall talk a little bit more about the tests. And also one of the things which is done at investigations is to find out if somebody has this bacteria or not. Dr. Resabu.
Maybe in addition to that, as she talked about this bacteria, usually you find that you could be having that bacteria, but you don't have the ulcers. What happens is having the bacteria, and then you add on these risks. You add on taking these NSAIDs for a very long period of time. You add on other risk factors like smoking. You add on other risk factors that cigarette smoking. So I find that even if you would be having this H. pylori and you survive with it, you're giving it a very fertile ground to cause what she has talked about. So you end up making the condition worse, giving it fertile grounds for it to cause the peptic ulcer disease.
Dr. Resabla, you raised a very important point. So this implies that actually it's many factors that usually come together.
There are many
it's not
factors,
a single factor.
yes. Of course, there are other things that also come in and they increase the risk. There's something that we call stress ulcers. This happens when we are in stress situations, as you hear stress ulcers. So there are ulcers that are induced under stress conditions. For example, if we have an ongoing disease in our body, the body is under stress. So you can end up having stress ulcers. If you're in a situation that puts you on tension, on stress, and it ends up interfering with, because like I told you, mucus production is a process. So the moment it's interfered by different factors, whether cigarette smoking, whether consumption of alcohol, whether you have a stressing condition, whether you're taking too much of NSAIDs, whether you have this bacteria that's happening, you end up with ulcers. Yes.
So one other thing that we have to note is that most people tend to think that hunger causes ulcers. So hunger has never and will never be a cause of ulcers. Hunger can only exacerbate what is already there. So for example, if one already has the peptic ulcer disease, you already have wounds in your stomach, in your duodenum, and you get hungry. First of all, if I'm to take us back, we know that hydrochloric acid is produced in different phases. So it can be produced in more amounts when the food has reached the stomach, or when you just think about food. And of course, when you're hungry, you're already thinking about food. So that will cause now increased production of hydrochloric acid. When you already have the wounds, like he had told us earlier, is that when you put acid to a wound, that means that the
You're
pain
going to experience the pain.
Yes, you get to experience that pain.
Yeah, sure.
Yes.
Wow. Quite interesting conversations here. And thank you very much, doctors, for making this very simple for us to understand. I think our audience out there can now understand what peptic ulcer disease is, what causes it. And doctors have highlighted about these sores that can be in the stomach, and maybe that should bring us to some of the signs and symptoms. Okay, so if somebody has this peptic ulcer disease, what are some of the things that they'll present with in a hospital setting? Maybe I'll start with you, Dr. Ainaite. What are some of the signs and symptoms for this peptic ulcer disease?
Okay, thank you very much once again. So the main presenting symptom that the patient will come in with will be epigastric pain. Some people call it the chest pain. This pain is usually around here. So what happens is that this epigastric pain, its nature will be burning. Like the patient will come in saying that, Musao, I have chest pain that is really burning, and we can use this particular epigastric pain to differentiate whether it is duodenal ulcers or gastric ulcers. So if a client tells you that the pain increases with food, then the doctor will immediately think it's mainly gastric ulcers. If a patient says that this pain reduces with after taking food, then the doctor will immediately think about duodenal ulcers.
Okay. Wow.
Maybe on addition to that, usually, as you have said, that you already have a wound either on the stomach or that very first part of the intestines called the duodenum. So if you eat food, you expect that probably this food is maybe hot or hotter than the body temperature. So this food is going to go and sit on the wound. Of course, as it sits on the wound, the end result will be abdominal pain.
Some bit of irritation.
Yes, so you have that kind of irritation and resulting into pain. Of course, it also depends on the severity of the ulcers, because you can find someone having a very small ulcer, then you can find someone having an ulcer that is above 0.5, half of a centimeter, or even going to a centimeter, and then ending in two perforations, as we shall talk about it. So if you find this food getting in direct contact with an existing ulcer, then that's when you have the abdominal pain. As she said, where do we find the stomach is on our left side. If you eat food and this food gets in contact with the wound that's already existing, that's when you have the abdominal pain coming in. And of course, it depends on how big the ulcer is. Usually, if you eat food and it takes around 15 to 30 minutes for you to have that kind of pain, that comes as a direct contact of food with the wound, that tells us that maybe it has happened very abrupt. It has not taken a lot of time. So we think that we shall think that this ulcer is much more in the stomach. And then if you take the food and it takes around 2 to 3 hours from the time that you've taken the food, that means that food has taken time in the stomach, it has left the stomach, and it's now in the duodenum. So that pain also tells us where exactly we're finding this ulcer. As well, we're having an acid. We're having overproduction of the acid. Like we said, this acid usually evaporates. So if this acid evaporates, it gets to the esophagus, which esophagus is also a thin kind of muscle. So it burns this esophagus, giving us that kind of chest pain. So you find someone having pain in the abdomen and then chest pain, we shall think, as medical workers, we shall think that maybe this person is having ulcers. On top of that, usually people come with bloating and abdominal fullness, that feeling of you take a little food and then after some time you feel that feeling of too much satiety, because you're having this acid being broken down to give you a gas, which gas fills up the stomach, and you end up feeling that kind of abdominal fullness, and then the bloating, which at times irritates because it's an acid and it burns all the way from the abdomen up into the esophagus.
Wow, doctors, thank you very much. You've shown us how these symptoms come about, how the epigastric pain comes about, how the bloating comes about. And I want our viewers to know that not every pain that you get maybe in the chest or this upper part of the abdomen is ulcers. So many things are possible. Sometimes it could be a heart disease. It could be a problem coming from the esophagus. And also, like doctors have put it, that the pain for ulcers is epigastric. Many times our patients get pain in some other parts of the body. Okay, somebody could get pain that radiates maybe to the back, which might point to things like pancreatitis or cholecystitis, and they're still thinking it's ulcers and they're managing a wrong thing. Sometimes somebody could get pain maybe in the lower abdomen and they think it's still ulcers, yet it's something else. So it's very important for us to know that the characteristic nature of the pain that comes in a peptic ulcer disease. We want to take another break and we shall be right back to continue with the conversation on peptic ulcer disease.
You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short break. We continue with the Doc Talk Show, a program where we bring you real doctors, professional and qualified, who have learned these things, who have studied the science, and they can tell us and explain to us how these things happen. Here, we bring you real solutions, real health problems. This program is brought to you by the Ministry of Health alongside the Cameline Men's Collection. If you have any feedback to give us or you have any questions for us, our numbers are right there on your screen. Please text us. Let us know if you have a question, for instance, about peptic ulcer disease. Doctors have told us about the causes, things like these strong painkillers that people take for a long period of time. They talked about a bacteria called H. pylori, which has been found in most of the patients who have peptic ulcer disease. Doctors have told us the nature of pain that people with peptic ulcer disease will be having. They have told us that it usually be epigastric. And doctors have told us about bloating. Patients are going to feel like they're having gas, they're feeling uncomfortable. Sometimes they could have dyspeptic symptoms. I don't know if there are any other symptoms, Dr. Resavla, that people with peptic ulcer disease could have.
Yes, of course, there are other symptoms that people with peptic ulcer disease have. As we said, you're having something like a wound, an ulcer on your lining of the stomach or the duodenum, which might tend to bleed.
Okay.
So if it bleeds and this person vomits, they'll vomit blood.
Actually, blood itself is very irritating.
It irritates. You've bled into the intestines, and it will irritate the intestines. So you end up with that forceful expulsion of the food, which we term as vomiting. So you end up vomiting flesh blood. But of course, there can be other causes of vomiting of flesh blood. But usually, if someone has that spectrum of symptoms that we talked about earlier, you're seeing they are vomiting flesh blood. You're seeing they're nauseous all the time. They have that tendency or that feeling or that urge to vomit. Likely we would think that maybe this person has an ulcer, and not just an ulcer, but a bleeding ulcer, because, like you said, blood is very irritating to the intestines. And then on top of that, if this blood goes all the way through the length of the intestine,
canal,
yes, the alimentary canal, through the small intestine to the large intestine, then to the rectum, and then someone passes out stool, this stool will be containing this blood.
So will it be red in color, like because blood is red in color?
No. Remember, this blood has gone all the way through that alimentary canal, meaning that it will change the form or the color. What was red before will now turn into black. So someone will end up passing black stool. So if someone is passing black stool, they are vomiting fresh blood. These are all things that can tell us that, hey, maybe there's a problem. This person has reached the extent of having bleeding ulcers, and they can even perforate any time. And that raises our index of suspicion. It directs us to something, and it requires urgent attention.
Okay.
Yeah, thank you.
Wow, Dr. Lestabula puts a very, very important point that actually, if somebody is bleeding, for instance, up this side in the stomach, symptoms could actually they could show up this in the stool, that the stool will be dark colored, simply because as blood passes through this digestive system, many enzymes act on it, and it will change even the color. The iron, which was there in blood, will change the color, and it will appear as dark colored stool, implying that if somebody has dark colored stool, it's a sign that they have upper bleeding in the upper parts of the digestive system. What are some of the complications of this peptic ulcer disease?
One of the complications is what he has talked about, that you could have a bleeding ulcer and you end up vomiting blood or passing stool that has blood. The other complication is that when this ulcer goes through the wall of the stomach or the duodenum, like we had talked about, if it goes through all the layers, it could end up, that means that it has perforated. So once it has perforated, it means that these gastric contents or the duodenal contents are going to leak through into what we call the peritoneum. That is the place where all these organs in the abdomen sit. So a patient can present with very acute, severe abdominal pain. And this abdominal pain it will be very severe, and it will need surgical intervention. Yeah, it could lead to a condition that we medically call peritonitis. So a surgical procedure must be done on that patient to open the abdomen and try to close that hole that has been created on the stomach.
Wow. That sounds very serious. And it, of course, shows us that we need to diagnose this condition early and then offer treatment to our patients quite early. So talking about diagnosis, Dr. Resa.
Maybe something small to add on the complications. Usually, these patients, as she talked about the bleeding, you expect that if the extent of bleeding is higher than the rate at which the blood is formed,
Yes.
you may end up with undeficiency anemia. So because of that continuous blood loss. But as well, patients who end up with stomach cancer, the cancer of the stomach, when you dig deep into how they were some time back, you end up realizing that they had signs and symptoms that were suggestive of peptic ulcer disease. So what at times begins as ulcers might end into very severe complications like stomach cancer. So that's why we are saying that people should not self-medicate. If you have any issue, if you have those signs and symptoms that we have talked about, it's better you seek medication. It's better you seek attention, because you'll be taken through a series of preventive mechanisms to ensure that what began as ulcers doesn't end up into gastric cancer or stomach cancer. In that case, yes.
The other complication that can arise is that once these ulcers heal by scarring or something that we call fibrosis, and if the ulcer was actually at the we talked about the duodenum being the first part that is just after the stomach. So if the ulcer was around that junction between the stomach and the duodenum and it heals by fibrosis, it's going to narrow that part where the food goes through the stomach to the duodenum. And once that part is narrowed, a patient will present with a serious abdominal pain still, but this is because that the food is not able to go through now to the duodenum, something we call gastric outlet obstruction.
Okay, this is happening because of the fibrosis, because you know very well that usually whenever you have inflammation, sometimes it heals by fibrosis. So if you form this scar tissue, of course scar tissue is not as elastic as normal tissue, you could get this scar tissue constricting and preventing the outflow, and I think that could require a surgical intervention to correct. Yes, so doctors have really put it for us very clearly that this condition could actually progress. It might start small, simple epigastric pain. It could progress into much more serious consequences. It could progress into a perforation. It can end up into stomach cancer. It can end up into gastric outlet obstruction. Another thing that we need to take note of, that many patients can have abdominal pain for a lot of time and they think it's ulcers, yet actually it's not.
It's something different.
Yes, many other things could actually cause epigastric pain. So it's quite important for us whenever we get these symptoms to seek medical attention, talk to doctors. They make the diagnosis and then they can treat us accordingly. So talking about the diagnosis, Dr. Savla,
yes, sir.
A patient comes to you and maybe they have these symptoms. How do you know that actually this patient has this ulcer?
Basically, like we talked about, that one of the things that causes these ulcers is a bacteria called H. pylori. So as we take this bacteria in food, because it's basically spread by poor sanitation and hygiene, eating contaminated food, drinking dirty water, so it ends up getting into our stomach and intestines. So this, like she said before, this is a bacteria that can suppress, or that can get away of bypassing the defense mechanisms within our intestines, because like she said, one of the functions of the acid that is produced is to kill the bacteria that escape with what? With food. So if this bacteria has escaped with food, it goes through the defense mechanisms of the intestines. We shall end up passing it along with the stool that we pass, or the fecal matter. So one of the tests that we do is to take a stool sample as health workers and look at this bacteria, look at whether this stool contains this bacteria, what we call the stool, the H. pylori stool test. I will take a sample of your stool, go to the lab and analyze and see, does this stool contain H. pylori? So if it contains H. pylori and someone is presenting with the symptoms, we think that these symptoms are because of the ulcers that are induced by this H. pylori. And then she talked about this H. pylori breaking down urea into ammonia that we will exclude.
And these are gases.
These are gases that also cause bloating. So one of the tests that we also do is the urea breath test, where we look at the amount of urea in your breath or in the air that you expire. So it helps us to know the extent of the ammonia The extent of diarrhea could also tell us what exactly is the problem, what exactly is happening with this patient.
Okay.
But before the tests, one of the things that we do, if a patient comes and they are talking about these symptoms, they're talking about these symptoms that could be suggestive. One thing that we should think about is, or one thing that we always do as health workers, to first get a story, or what we call history taking.
Okay.
Talk to this patient, know how exactly the symptoms are, how severe are they, how are they coming, how are they changing with food, how are they changing with the medication that they have been taking at home. Because like I said, Africa, basically, whereby Uganda is part of Africa, we are self-medicating people. So we have to take the history and narrow down to what exactly. We have to exclude other causes that you talked about, because someone could be having abdominal pain that is caused by something different, which is not ulcers. So we take the history to help us to narrow down and taper and say that this pain is not caused by this, not caused by this, but likely caused by ulcers. And then we shall also examine you. In this examination, we are looking at where exactly are you feeling the abdominal pain.
Okay.
We want as well to exclude, are there masses on the abdomen? Is there anything that could tell us that this abdominal pain is not because of the ulcers, but rather something different? So history examination will help us also to narrow down before we even go to the investigation. The investigation is actually coming later.
Well, wow. Thank you very much, Dr. Resavula, for taking us through some of the things that you doctors go through to come to a diagnosis of peptic ulcer disease. We are going to take a short break, and when we return, Dr. Inaitwe, I want us to tell us about the endoscopy. We always hear about endoscopy. What does it mean? What do they do in endoscopy? For now, keep it Doc Talk Show. We shall be right back.
You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
You are watching the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
Welcome back from that short break. We are continuing in the Doc Talk Show. I'm sure you're enjoying this conversation about peptic ulcer disease. I'm sure you're learning something new. You're learning how this condition presents. You're learning that not all abdominal pain is ulcers. So many things are possible. You must have learned by now that some drugs which we take, especially for pain for a long time, the drugs which are called NSAIDs, could predispose you to ulcers. You must have learned also that there's a bacteria called H. pylori, which has been implicated in most of the peptic ulcer diseases. Doctors have told us about how they come to know that this patient has this condition. And apart from the H. pylori, which Dr. Resavula has told us, we want to look at another investigation that is commonly done for patients who have peptic ulcer disease, and that's endoscopy. Dr. Inaitwe, tell us about this endoscopy thing. We always hear about it. People with ulcers do it, but our viewers out there want to know, what does endoscopy mean?
So endoscopy is a test that whereby we get a camera. We get a small tube that has a camera on top of it, and this small tube is passed through the mouth into the stomach to visualize the stomach and the duodenum. So this particular one that we do for peptic ulcer disease is called esophagogastroduodenoscopy.
A camera in my stomach, is it too big?
No, it's very small, and what we do is that we first relax the patient. The patient will not be feeling anything as this procedure is taking place. So what happens is that during this procedure, we visualize the inner lining of the stomach. We get to see if that wound is actually there. And if that wound is actually there, we can take off a tissue around that wound, a procedure we call biopsy. So we take off that tissue and we give it to this other special doctor that looks at these different tissues to determine whether this particular tissue can be cancerous or it's actually not cancerous. So the other thing that we do during this endoscopy, like we talked about the complication being a bleeding ulcer. So during endoscopy, we can do a procedure to close off those vessels so that they stop bleeding. So the endoscopy procedure can be diagnostic and also it can be used to manage.
Okay. Awesome. So a patient comes in there, they tell you you're going to do endoscopy, just know they're going to put a small camera.
A small camera.
Yes.
Technology has advanced.
Yes.
Now someone can just actually have something as small as half a button being
Yes,
a
yes.
camera. So
Mm.
you expect that that camera will be very, very small. It will not be like these cameras that we're using for pictures and all that. It will be
Yes.
just a very small camera that
Okay.
someone is comfortable even swallowing.
Okay.
And I've seen now with technology advancement, someone will be taking something like a pill with a camera inside.
Oh.
No need of now connecting a tube or something.
Yes,
Someone
yes.
just swallows something, a
Pill.
very small pill.
Mm.
It goes in, takes very
Pictures.
many pictures as you want,
Mm.
and then someone passes it out with a stool.
Yeah.
Yes. So that's where technology has actually taken us.
Wow.
Yeah, sure.
Wow. Very interesting. Very interesting. And I hope you're appreciating how science is advancing. And as all these advancements happen, even us in health, we're picking on them and we're utilizing them for the benefit of our patients. Yes, Dr. Alina Itwe, tell us a little bit about the treatment. If you've confirmed about that this patient has peptic ulcer disease, maybe you've done your stool H. pylori, you've confirmed it's positive, you've done your endoscopy, you've seen they have those ulcers in the wound. So how do you treat, or what would be your goals of treating these patients?
So during the treatment, one of the things that we want to do is that we want to suppress the acid that is being produced, that acid that is causing that irritation and worsening the ulcers that are already there in your stomach. So we want to suppress the acid. We use the different drugs. Some that you know, I don't want to mention them on camera so that you
Yes.
people go to the pharmacy and
Self-medicate.
I'm running to buy this particular drug. The other thing is that once we have confirmed that you have H. pylori, we want to kill that bacteria. So we give you antibiotics that are used to kill that particular bacteria.
Okay.
So during that peptic ulcer disease treatment, that is mainly what we are doing. Complications are managed differently, as we had talked about earlier.
Maybe the challenge that we've seen with our people is the adherence to medications.
Yes, yes.
Because you find that someone buys some drugs to suppress the acid from the pharmacy, they take them for 1-2 days, get symptom relief, and then they stop.
Yes.
Treatment of ulcers is quite a very long process, not something that we do as when maybe someone gets a headache. Usually prefer this treatment to last as far as 1.5 months. Those are like 6 weeks. So that means that even if you take them, if a medical doctor prescribes for you this treatment, you take the treatment for 1-2 days and then you get that symptomatic relief or the symptoms kind of subsiding, you shouldn't actually stop.
Yes.
Should ideally continue up to when you finish the medications and then go back and be reviewed to find whether there is an improvement, whether the symptoms have completely subsided. We can actually repeat these tests and see whether the bacteria has completely been eradicated, or even repeat an endoscopy to find out whether those ulcers have actually healed completely.
Wow.
Yeah.
Awesome. Thank you very much, Dr. Risaula, for that. I've met quite a number of patients who actually believe that ulcers don't heal. They feel like the moment you have ulcers, it's a dead end. You'll have ulcers until at the end of time. And this is not true. Ulcers can be managed and treated, and you can get complete cure from ulcers. However, most of the times patients don't adhere to the treatment. After taking the medication, maybe they have taken for 2 or 3 days, they feel some relief, they stop until when they get another episode and then they take again. But if only we adhere to the treatment.
That's what actually I want to talk about.
Yes.
That's at times you can get a recurrence. Despite the fact that you've taken these medications, you've
Got well.
been adhering to them, these ulcers have actually been eradicated. You can, because of the continuous exposure, maybe we don't change the environment, we don't change our sanitation and hygiene, we end up taking this food that is containing this bacteria again, and we end up having another episode of the ulcers. So ulcers heal, but the challenge is we have constant exposures, and then we end up having them coming back most of the times. Yes.
All right. Constant exposures, poor adherence to treatment, poor health-seeking behavior, all of these compound together and they make the problem much worse. Dr. Alex, as we almost concluding this show, our viewers would so much benefit from prevention. How best can this condition be prevented?
How best can we prevent this condition?
Yes.
One, some of the things that we talk about in prevention is, of course, there are factors that we cannot change. For example, me being born to maybe someone who has ulcers, because that could maybe put me at a risk.
Yeah, there's some genetic predisposition.
There are things that we cannot change, but we are looking at things that we can change. She talked about these ulcers being much more in males than females. This is something that we cannot change.
Non-modifiable.
Yes, we cannot modify them. We cannot change them. But there are things that we can change, as we talked about them. One, we can change our behaviors, our smoking, our alcohol, the rate of consumption of alcohol. It's something that we can regulate. We can regulate the rate at which we take this bacteria in dirty food, in dirty water that we take. This is something that we can change. So, and as well, because prevention is a spectrum, if I can do prevention by preventing the disease preventing myself from getting the disease in the first place. Then I can prevent the disease by ensuring that I get to know that I have these ulcers very early so that they don't progress. Meaning that if I get these symptoms and I go to health personnel to be diagnosed and start treatment early, I'm actually preventing.
Okay.
If I'm prescribed these medications and I take them as I should actually take them, I'm also doing what? I'm also preventing. So prevention takes a spectrum of one, preventing the disease from happening. And then if it happens, what should I do to ensure that it does not progress? And these are things that we've been always talking about.
Okay.
Seek medical care very early and then adhere to the medications as much as you can.
Okay.
But as well, to patients that are having ulcers, usually there are things that we also tell them to do so that we don't have exacerbation of the ulcers. As she talked about the acid production being insinuated or being initiated when we eat food or think about food. That means that as we increase the amount of the food that we're eating at a particular time, we are also increasing the amount of the acid that we are excreting at that particular time. So always patients with ulcers, we advise them to not to do what we call binge eating. That maybe spend a day without eating and then in the evening eat to death or eat up to when you cannot breathe. It's not something that we always advise. We advise that take small portions of food but frequently, so that you have this steady production of acid. Not to take a lot of food at one time and you end up having a lot of acid being produced at once. And then also something with our nutrition habits. Usually you find that there are foods that we eat and we have that feeling of chest pain. Even if when you don't have ulcers, there are foods that we normally eat and we have a feeling of that kind of heartburn because these meals actually have a lot of acid that they insinuate a lot of acid production. Foods like pineapples, beans in very large amounts, they initiate too much acid production and someone ends up having that kind of chest pain. So always advise patients that don't leave these foods completely, but try to reduce them. So prevention is really better than cure. The moment we prevent these diseases from getting them, that's the best that we can do for ourselves. Not to treat, because even we can treat and we fail and we end up with complications.
Wow, Dr. Saula, thank you very much for bringing us to speed with some of the prevention techniques that can be done to prevent this condition. Maybe in the last 1 minute, what would be your parting shots, Dr. Saula, as we close this show?
One thing that I want to tell Ugandans and all our viewers out there is that let's prevent the diseases that you can prevent as much as you can, because treatment is very expensive and also treatment failure is also possible. And as well, let's avoid self-medication. Don't just go to a pharmacy and buy medications and take them. Just go to a health worker, visit a health worker, a licensed health worker, be examined, be checked, and if they give you medications, take them to completion. One thing that I always say is a healthy nation is a wealthy nation.
Wow.
If people are healthy,
they
are going to work,
the wealthy nation
and end up being more productive, hence resulting into a wealthy nation.
Awesome. Dr. Esther, what's your parting shot?
What I want to emphasize again is the self-medication, especially with these antibiotics. You've seen that we use these antibiotics in this very common condition. So imagine we all just self-medicate. That means that we'll end up having antimicrobial resistance. That means that we'll get to a point where these antibiotics are really not enough or are not going to help us treat our conditions. So please stop self-medicating. Because I know with that we'll be better people. So thank you so much for listening.
Wow, thank you very much, our beloved viewers. I'm sure you've learned something. Don't forget to catch us next time, same station, Doc Talk Show. For now, from me and the crew, we want to wish you a very good evening and enjoy the rest of the night.
This message is from the Ministry of Health with support from partners.